The World Health Organization has declared a global public health emergency over an outbreak of a new strain of the Mpox virus in Africa. Sweden has become the first country to register a case outside the continent. The virus, which was formerly known as monkeypox, can spread through close contact. It causes flu-like symptoms and lesions on the body and can be deadly. This latest surge is believed to have started in the Democratic Republic of Congo.
Mpox is surging across Africa. And this is ground zero. Thousands of cases have been reported in the Democratic Republic of Congo as a new outbreak grips the country. It's already claimed at least 450 lives, most of them children, and it's showing no sign of slowing down.
We're worried. We don't feel that the government is mobilizing or that it's concerned about the best way to try and control this epidemic, which is threatening the Congolese population.
Formerly known as monkeypox, Mpox spreads through close contact, causing flu-like symptoms and painful pus-filled lesions. But this new strain is proving more infectious and even more deadly. And experts fear the growing outbreak in Africa could just be the tip of the iceberg.
This is not just an African issue. Mpox is a global threat, a menace that knows no boundaries, no race, no creed. It is a virus that exploits our vulnerabilities, preying on our weakest point. And it is in this moment of vulnerability that we must find our greatest strength and demonstrate that we are all learning from the COVID lesson and we are playing solidarity.
The World Health Organization last declared Mpox an international health emergency in 2022, with cases in more than 70 countries. That was largely shut down with the help of vaccines and treatments in rich countries. But very few of those are available in Africa, and global health officials hope this new emergency declaration will kickstart an international effort to contain the disease.
Well, just a short while ago, I spoke to Professor Salim Abdool Karim, an epidemiologist who chairs Africa's CDC Emergency Consultative Group, and I asked him how this Mpox outbreak is different from the one we just heard about in 2022.
Yes, we are seeing quite a different situation right now. So if you just look at the number of cases of Mpox that we have now, it's about 3 times higher than the number we had in 2022 when the World Health Organization declared a public health emergency of international concern for Mpox at that time. So we are seeing many more cases at this time. But it's not just that we are seeing many more cases. The number of cases is increasing each week. So we are seeing an upswing in the number of new cases. And our concern, thirdly, is that not only are we seeing a lot of cases and the cases are rising, but that the case fatality rate, the proportion of patients who are dying, is unacceptably high. At this point, it's running in the DRC and in broader Africa at about 3%. And that's simply, a level that we have not seen previously. And then finally, the fourth issue we looked at, the criterion we looked at, was whether it is spreading beyond the borders of the DRC, and that's certainly the case. In the last few weeks, 3 countries that previously hadn't reported Mpox are now reporting cases of Mpox. So it has gone beyond the borders of the DRC. So we got a lot of cases, far more than we've had before in 2022. Yeah. We're seeing an upswing in the number of cases. We're seeing a higher than expected death rate, and it's spreading beyond the borders of the DRC. All of that constituted enough grounds to declare a public health emergency.
And we just found out about a case in Sweden. Are we looking at the prospect of a new pandemic here?
I think once we start seeing it spreading beyond the boundaries of the DRC, there's nothing stopping it from spreading everywhere. And that's going to be an issue for us because there's so much of travel, there's so much of mixing, and Mpox can also occur in a way that's very mild, and so people will not recognize that they have this illness, and that's a big issue as well. Right now, it looks like the clade 1b version of the virus that's spreading in the DRC spreads quite readily through sexual transmission, and so that opens up pretty much any part of the world in terms of risk.
But it's also spreading quite rapidly among children, and it's proving to be quite deadly for them. Why is that?
So in the past, populations were somewhat protected because the elderly people and the adults had been vaccinated against smallpox. And so that provides some measure of protection. But now we have a growing susceptible population that have not been vaccinated, and that especially amongst the children. So if we look at this particular clade 1b, that's the particular variant of this virus that's spreading in the DRC, and it's only at this point in the DRC. As it's spreading to neighbors, we're seeing sexual transmission, and then from adults, we're seeing transmission to children. In fact, around half the number of cases in the DRC are in children, and that's quite a big concern.
Would you say it was a mistake then to stop vaccinating against smallpox?
No, I mean, who would have predicted that we would be in this kind of situation? I think the decision was the right decision at the time. What we need now is a highly effective Mpox vaccine that we can provide in the entire community. We don't have that. The vaccine that's available, we don't even know its clinical efficacy, is very expensive and doesn't lend itself to mass immunization. So we use the vaccines very judiciously to those only at high risk. So right now, we don't really have the kinds of tools in terms of vaccines. So we've got to go back to public health measures, which are highly effective. And that means case identification, identifying everybody who has Mpox. And you've got to have the diagnostic tests. So it's not just the clinical diagnosis, but also making the diagnosis in the laboratory. And once we've got a diagnosis, is to then do the contact tracing and ensuring that all of those who come into contact with this individual are in isolation. So you stop the onward transmission. So those public measures work. The problem has been that in the DRC that's affected right now, the southern Kivu region, there's a political instability. In fact, there's a warfare in that area. So the hospitals are struggling to function. We can't even get the specimens to the laboratories. There's a whole chain of problems that's enabling the virus to spread in that part of the country.
That was epidemiologist Professor Salim Abdool. Karim, thank you for your time and all those insights. All the best to you. Kupferschmidt is a science journalist and molecular biologist. He joins me from Washington. Welcome to DW. And can you tell us more about this latest surge in Mpox cases? How is this outbreak related to the one we saw 2 years ago?
Yeah, that's a great question. And I think it needs a little bit of context. So let me try and go back a little bit, maybe. We've seen outbreaks of Mpox in Africa for more than 50 years, right? Basically outbreaks in Central Africa and then in Western Africa. And over time, these have become bigger, they've become more frequent. And what we saw in 2022 was that one of these viruses, specifically one of the lineages, clade 2b, made it from Nigeria into kind of the global sexual networks of men who have sex with men, and it just spread really fast in this group, affected mostly this group. And then over time, because of vaccination, because of immunity after infection, and because of behavior change, this kind of global surge died down again. But the situation in Africa didn't really change, and we're still seeing this slow increase over time in cases. And what we're seeing now is that another lineage, which is 1b in Central Africa, in the Democratic Republic of Congo, has just kind of jumped into another sexual network. So we've had reports in 2023 already that in Kamituga, a mining town, we've seen outbreaks in sex workers. And so we're seeing, again, this kind of driven by sexual transmission in this group, but then we're also just seeing the background of all of these clade 1 cases that we see in the DRC increase over time anyway. And so you can think of the outbreak in 2022 as a kind of, a little side fire that was started by a spark from what is essentially an ongoing situation in Africa that we just haven't really attended to over the last years.
And what makes this new strain so dangerous?
So we don't know, and this is a really crucial point, I think. We really don't know whether this new strain is more dangerous than the strain that we've seen before. And the reason we don't know it is very simply that whenever you see a virus act a certain way in a population, you don't know whether that's because the virus is a certain way or whether that has to do with how the population reacts to it, right? And so we've seen in the past that this clade 1 virus in the Democratic Republic of Congo leads to more severe cases, it leads to more deaths. But is that because the virus is more dangerous, or is that possibly because in that particular setting, with the healthcare system being the way it is, with comorbidities with measles, chickenpox, HIV infections being the way they are, is it possible that it has more to do with that than the virus itself? We just don't know that. And so we really have to be patient. And one of the hopes in this situation is that now in the next weeks and months, we will get more clarity on whether we really have to be more concerned about this virus than about, previous versions of it. But whichever, whatever the answer is, clearly there is an ongoing situation that is worrying.
Yeah, there is a lot at this point that we don't know, and that kind of reminds of, I bet you as well, of a situation not too long ago where there was a virus making the rounds, a global pandemic. There was a lot of uncertainty. What has the COVID-19 pandemic taught us that could maybe help keep this outbreak at bay?
Yeah, I think the number one thing is what you just said. It's that there are a lot of question marks and uncertainties in the beginning, and we really have to push to get certainty on them. But then we also have to act really decisively, even while there are still question marks. And I think the fact that the WHO declared this a public health emergency of international concern yesterday, fairly quickly and decisively, I think, is a good sign, because I think that is something we should have learned from the pandemic, that we need to get ahead of this. We shouldn't wait until it has spread to a lot of other countries. We should try. And the other thing, the biggest thing we should have learned from the pandemic is that equity matters. It matters, that people in Africa have these vaccines available, and not as it has historically, traditionally been, and as it was in 2022, that these vaccines are, given out in the global north and in the global south, where most of the burden of this disease is. There's barely any vaccine available. And I think this declaration really needs to be a push to change that.
That was science journalist Kupferschmidt. Great speaking to you. Thank you so much.
Thank you.